And here is your question. Right, so if you have read and understood considering a clinical examination station, kindly begin.
Okay, I'll enter the bay. I'll wash my hand. I'm Dr. Olu, one of the surgical doctors here. Can I please confirm your name and age, please?
Yes, I'm Smith, 76 years old.
Okay, Smith, nice to meet you. Today, I want to examine you. I'll need to examine your groin to see the wound and the swelling that you have. Hope it's okay by you.
Yes.
Okay, all right. So I'll need a chaperone to be with me.
Okay, good.
Is that okay by you?
Yes.
Okay, all right. So the chaperone is inside. Okay, so you need to expose yourself. Kindly expose remove all your underwears and then roll your clothes up from your navel down, from your belly button down.
Yes.
All right, thank you.
Yes.
So I'm looking to see for any the swelling that is on the right side. Then I will also, can you please lift up your butt? So I'm also going to look at the posterior part of the butt to see if there is any wound or any other swelling from it. Then, okay, thank you. Please, can you look up? Can you please cough a bit?
Okay.
Cough. Okay, so you have coughed. Then I'll put my hand on it again. Can you cough again, please?
Yes.
Okay, all right. So, so after that, okay, I want to ask, do you have pain at anywhere, please? On your okay, no, okay. So I'm going to, he's standing up, sorry, he's standing. So I'm examining him in standing position. So I'm going to do check for tenderness. So as I'm palpating it, I'm looking at him to feel if he's having pain. So I'm going to palpate from the right inguinal down to the scrotum. And then after that, I'm going to check for differential warmth also. Then after that, okay, Smith, can you please can you reduce this thing for me?
No, it doesn't get reduced.
It doesn't get reduced. Okay. No. Okay, all right. So that's fine. Okay, so since it doesn't get reduced, I will try and see if I can reduce it. So, but before I do that, I want to do some other tests. So I will try to, so can you please lie down for me?
Yes.
Okay, so after lying down, I will try to reduce the mass back inside. If I'm able to find, if I'm able to do that, then I'm going to check palpate is the scrotum away from the mass. Then later I'm going to ask him to stand up again, and then I'll
when you're examining, can you elaborate? What would you look for?
Okay, when I want to reduce it, I'm going to make the contents back into the intestine.
Yes, you'll try to feel for the neck of the hernia.
Yes, then yes, and then use my hand, my two fingers at the neck of the deep inguinal ring, and then try to make the contents back into the abdomen.
Yes, and then you'll feel if testis is separable or not.
Yes, and I feel that testis is separable or not. Then after the testis is separable, I'm going to now do the deep ring occlusion test. So I'm going to put my thumb over it and then tell him to cough. So when he coughs, I'm going to check if there is any swelling coming or not. If no swelling is coming, then I will remove my hand and ask him to cough. If the cough comes out, then that means is a direct inguinal and is indirect inguinal hernia. But if by the time my hand is there, it coughs and nothing is coming, not something comes out, beside my hand, that means it's a direct inguinal hernia. Then after that, I'm going to check the listen to the hernia using my stethoscope, and then also I
in
would
the
dim
stem, it says it's reducible. So
yes, ma'am.
mass is there, but mass can be reducible, but it is non-tender. So now
Yes.
tell me what the rest of the examination, please.
So after reducing the mass, I'm going to check do the deep occlusion test to check whether it's a inguinal hernia, whether it's a direct or indirect. For the indirect, once I put my hand to occlude the deep inguinal ring, the swelling will not come when he coughs. But by the time I remove my hand and then he coughs, then the swelling will come out into the scrotum. That's the indirect. For the direct, by the time my hand is there when he coughs, it's going to come beside my hand. The swelling is going to come out. So that's what will make me differentiate whether it's a indirect or direct inguinal hernia. Then after that, I'm going to listen to the auscultate over the mass to see the whether it's bowel that is inside or not. Then after that, I'm also going to tell him to dim the light inside the room and then do transillumination for the swelling to see if it transilluminates or not. Then I'm going to go back to the left side to also examine the left testis and see that there is no mass there. Then to complete my examination, I want to examine is abdominal examination, and then also examine is do a digital rectal examination and then do a chest examination for him. Then I'm going to cover him, then wash my hand, thank you, and then assist him to dress up.
Okay. So can you present your examination now? 10 seconds are left.
So I've examined Mr. Smith, a 76-year-old that presented with a right inguinoscrotal and reducible mass. The mass is not tender and there are no differential warmth over the swelling, and there is no area of ulceration. I was able to reduce the mass, and the mass is separable from the testis.
Okay. And
so the deep inguinal ring test is positive. So my diagnosis is a right reducible inguinoscrotal hernia.
Okay, good. How do you plan to manage this patient?
Yes, to manage him, I want to do take a full history.
Wait, what are the differentials that you'll consider?
Yes, differential that I will consider. I also consider a retractile testis, and then also I will consider a testicular tumor. Also will be one of my differentials.
Yes.
Then
so yes, how would you manage?
Yes, to manage him, I want to take history, detailed history, and then fully examine him. And then I want to do some tests to rule out anything that could be making him have any increase in intra-abdominal pressure or anything predisposing him to cough. So I want to do chest X-ray to rule out any chest pathology that making him cough. And then also want to do abdominal pelvic ultrasound to rule out any abdominal mass in him. And then I will find him surgery to repair the defects. Okay.
How do you plan to repair the defect?
Yes, I can do an open surgery, and examples of open surgery using the modified Bassanic procedure or Schudi's procedure can be done. And then I can also do a laparoscopic approach to repair the hernia.
Okay, with or without mesh?
Yes, for open, I will do mesh repair.
Okay. Any other advice you'll give to the patient?
Then after this, I will treat any underlying thing that I find out, any underlying cause that may be making him to cough or anything that may be making him to strain. I also make sure that I evaluate him that doesn't have urinary tract symptoms that could making him strain while urinating. Then I will advise him to avoid heavy activity initially before the wound heals properly. Okay, good.
Thank you. Some feedback that I want to give you. Considering the age, which type of condition is most common?
The type of condition?
Yes, which type of hernia is common.
Okay,
considering
hernia,
the
yes.
age.
For this age, it's going to be the direct hernia, ma.
Direct, yes. Okay, did you transilluminated the patient?
Yes, ma. I did, ma.
Okay, I'm sorry, I missed. Transillumination you have to do, and always remember that once you're palpating the lump on the side, then you have to palpate the other side as well,
Right.
just to rule out if there is some negligible lump that cannot be seen but is present. So always mention that you examine the other side as well, not just the right side. You'll examine the left as well, even
Yes,
though
ma'am.
it says it's otherwise healthy, but still you have to. Okay, good. Thank you.
Madam,
Yes.
it is a good presentation.
Yes.
I want to say that if first, if it is irreducible, for example, irreducible,
Yes.
then the doctor will say to the patient, reduce by yourself. Patient will reduce.
Patient, yes. And if patient says it doesn't go away, then I don't think you should make any attempt.
Yes, if patient cannot reduce it, then I will not reduce it.
No. So
No, I
this
will
you
not
have
do
to
the deep vein
remember it.
occlusion test.
No.
And if patient say that, yes, on standing, I can reduce.
Or
and
by
on
lying
lying,
down, I can reduce it.
then I can reduce. Then I will try
Then
to
you can
reduce
ask,
again.
okay, you do it. Because if you'll do it, you may cause pain or discomfort or yes, to the patient. So it's better you ask the patient to do it.
Yes, but
themselves.
if he patient allows me, then I can reduce it. That no pain, then I can reduce it.
Still, yeah, be careful in exam, because if little discomfort you have raised or caused to the patient, this can cost you your exam. Yes, Dr. Kalade?
Thank you, ma. I want to ask a question.
Yes, please.
In the Basil book, it said we should, when we want to examine the inguinal hernia, that we should not wear gloves. So I'm really confused. Is that
No. Yes, you can do all examination with gloves, but how would you feel the temperature or tenderness? Like if it's to know the temperature, you can't do it with the gloves on.
Okay,
You have to feel it. How would you tell with
Okay.
the gloves on if the patient is tender or if there is any warm or any redness you can see, but to see the temperature, you have to do it without gloves. So you
Okay,
can't examine the patient with the gloves on.
gloves
But
on.
you have a chaperone with you, and this is very good that you remember that this patient and in this examination you have to keep the chaperone with you. So
Okay,
good, yes. And what Dr. Kaur just said, remember please not to reduce the hernia yourself. Always ask the patient to do it for you.
reduce it. Okay,
Yeah.
ma.
Because that can, don't take the risk, even if it can be reduced, don't do it yourself, because if patient says or
Okay.
any discomfort, so it can cost you your exam. Thank
Okay,
you.
ma. Yes, ma.
Thank you.